Welcome back to Daytime. Now, the Trillium Health Center recently launched the Adolescent Mental Health Outreach Program in the hopes to support young adults one at a time who may be going through a disorder in the Peel region. And here joining us to tell us more is Chief of the Mental Health System, Dr. Rose Geist. Thank you for coming today.
Morning.
Now, Dr. Geist, please tell us about this program. I understand that it launched in December, which was just a few weeks ago.
Well, this program is geared at young people who suffer with anxiety and depression, who are at home because they're unable to either come to the outpatient program or because of their symptoms or distress, unable to leave the home. So the program itself supports both the kids and their parents to help them develop coping mechanisms so that they can leave their home and come to the school at Trillium or just basically engage in their lives.
Now, how does the program actually differ from other mental health programs that are out there?
Well, this is a very innovative program because it's outreach based, which means that our social worker, who will be a half-time social worker, will go right into the home and try to help the parents and the young person develop coping mechanisms. So most programs don't go into the home. They're based either in an outpatient clinic or in a school or in a physician or a mental health consultant's office. So the innovative part of it is the outreach, the going into the home activity.
So, Dr. Geist, as of right now, do we know what the population is in terms of young adults who are affected by mental disorders in the Peel region?
Well, that's a very broad question. The general number that's given is about 10% have some kind of mental health disorder. Now, that doesn't mean they're disabled by it. A smaller proportion are disabled to the point they're unable to go to school or leave their home. So we're talking about a small population, but an important population.
So let me ask you a question, because adolescents in general go through a lot of phases, a lot of changes throughout the teen years. How do you know if you're dealing with just something that is a typical phase that an adolescent is going through versus what might actually be a serious mental problem?
Well, usually it's the degree of symptomatology and the duration. So young people who suffer, as you point out, we all go through ups and downs and anxiety and depressed moments. But kids who have these symptoms that are severe enough that they interfere with their function, so they can't sleep, they can't eat, they lose weight, they can't leave the house, they have a number of other functional, what we call functional impairments. So generally speaking, it's not just the presence of an unhappiness or symptom, it's the degree and the associated functional impairment, and also the duration has to be consistent for at least 2 weeks before we consider it a disorder.
So when it really sort of impedes on your day-to-day goings-on?
Yes, that's a very important sign when you can't function because of the symptom. And function is determined by sleep, by eating, by some kids will get pain that will stop them from functioning. The more severe kids can't get out of the house at all. Some kids can't get out of bed. Some kids are extremely tired. So you can see a lot of physical symptoms that accompany mental health disorders and functional impairment.
And do you find that suicide is a very big issue, a predominant issue in the population who is dealing with mental issues right now?
Well, suicide is associated primarily with a mental health disorder, such as depression and severe anxiety, substance abuse. So we often see suicidal thinking, sometimes suicidal behavior, and in some cases completed suicide in those young people who have mental health disorders. In fact, suicide is one of the commonest causes of death, unfortunately, in young people between the ages of 18 and 24. But suicide is not always associated with a mental health disorder. But most commonly, that's what we see, a primary mental health disorder and problems with impulse control in particular.
Now, the program, obviously, your aim of this is to assist these youth in overcoming these problems, overcoming these challenges. And I know that the program is very fresh and very recent. Have you seen a lot of successes come out of the program thus far?
Well, we have only just started it, and we're going to, we just hired our social worker, actually. Okay. So we anticipate successes, but I can't tell you that we have data yet.
Okay.
Of course, for more information, you can visit www.trilliumhealthcenter.org. And I'd like to talk about the mental health and its main issues right now that you're dealing with. What are the main issues we're seeing in adolescents today in the Peel region?
Well, are we talking about mental health disorders?
Yes.
Well, the commonest one is anxiety-related disorders. And anxiety can often manifest in school refusal. So there are kids who will come to their family physician or their pediatrician with headaches or tummy aches, and so they can't go to school. And underneath that, there is an anxiety disorder. Anxiety is more common than depression, but they often go together. So when we're looking at primary mental health disorders, we're usually looking at anxiety, depression, and very commonly complicated by what we call concurrent disorders, which are substance abuse.
Now, we see a lot of, kids can come home, they can be anxious about an upcoming test or an exam. Maybe they could be bullied on the playground, something like that. How do you know when it's not just a one-off issue and it's actually developing into something a little more serious?
It's usually when it's sustained or it's associated with functional impairment.
Like over how long? Like a month?
A couple of weeks.
A couple weeks.
Or if the problem is recurrent. Now, bullying has become a very important problem associated with real distress in young people. So when we see bullying, and there are a lot of educational initiatives now for bullying, we take it very seriously. Both internet bullying and bullying in the playground. So you mentioned bullying briefly, but bullying is very important.
Absolutely. Well, definitely lots to consider for sure, and lots to think about. Obviously, mental health is a huge challenge, and a lot of people do deal with it day to day. So definitely, if you want some more information, definitely you can contact Dr. Geist and her associates, trilliumhealthcenter.org, for more information to get some assistance that you might need. But when we come back, we're going to be talking with some brave young ladies who are dealing with problems of their own. You're not going to want to miss it. They've got some really great stories coming up on Daytime after the break. Stay with us.